Well, two lawmakers are offering COVID-19 testing for healthcare workers, caregivers, and patients who may or may not have symptoms at an event in KITV today. Representative John Mizuno, who's the chair of the House Health Committee, joins us on the line to tell us more. Good morning, John. Good to see you.
Good morning, Annalisa. Thank you for having us.
Now, this event that's going to start at 10 a.m. actually is one that you're partnering with Representative Rita Cabanilla on. Tell us about why you decided to have this event.
I think it's important to get not only community members, but a targeted segment of our population. This would be our care home operators, their staff, their family members, as well as the patients. Again, this would be the patients that are elderly and many with disabilities, most likely the most prone to catch COVID-19 with a devastating effect thereafter. So we really targeted this group, and we wanted to give them a chance to get tested as we're trying to remain safe and reopen Hawaii.
Well, there's been some debate, obviously, on whether asymptomatic people should be tested in the first place. Now, in this particular one, you are inviting people, just to be clear, that may not be showing symptoms. Now, is that a bit of controversy for your end, and why we're, I guess, promoting it?
Absolutely, and it can be, perhaps, if somebody wants to say, you should be symptomatic before getting a test. You know, we've got antibody tests. So in addition to the nasal swab test to show that you've got an active virus, we're also doing the blood tests, which will show antibodies. So even though you may not be symptomatic, you may have been exposed to the coronavirus, and therefore you have built antibodies. And that's what we're trying to do. So in addition to those two tests, again, this is a critical group, a population in our society that we need to make safe. Keep in mind, of the over 2,000 community care homes, nursing homes we have in the state, and over 13,000 patients they care for, we have not had one recorded death due to COVID-19 yet. We want to keep it that way. We want to make sure as we reopen, we're going to do this prudently and smartly, and so that's why we're doing this.
And John, you know, I spoke to some people in the community who have not gone to these particular events because they're worried that they'll just be turned away. So they wait for a while. They'll be talking to a doctor who says, sorry, you're not eligible for this screening. Will this happen here?
No, I will share this. So two things. Number one, this is not free testing. They just need to know that. But number two, they do need their insurance card. As long as they have their insurance card, they're going to be fine. And the last point I want to make, I apologize, this is on me. We actually start testing at 8 a.m. to 12 noon at Cedar Church in Kalihi. But the reason we put the 10 o'clock time is for the media. If they were to come, we've got space for you and everything lined up so you can easily get in and get out, because we anticipate long lines for this testing today.
Okay, well, good to know. 8 a.m. for our viewers who are interested in learning more about this, and you can walk up and drive through. And just there's some other things that you're working on, some programs, the PPE shortage for home care facilities, as well as, I guess, the CVS self-testing that we're hearing about. Can you briefly talk about those events?
Yes. I'll take the PPE question first. The concern that we have a number of health inspectors walking into people's homes, care homes and nursing homes with their shoes on. The new policy was to refuse to take off their shoes for their safety. Now, the care homes got a hold of me and said, hey, there's a possibility of these inspectors bringing COVID-19 on their shoes into our community care homes and nursing homes. And so once that happened, we looked up the CDC guidelines. We didn't see that being there. If anything, you need to have a disinfectant policy or protocol if you are to walk in with your shoes. So we respectfully, emailed and contacted the Department of Health, and we're able to work that out. You can either put booties on or disposable things on your shoes before you get in, or you just spray your shoes down with a disinfectant or take them off. The people want them to be taken off. That, and then the fact that we have been working on getting more PPEs to the hospitals, healthcare workers, not only the frontliners, but all healthcare workers, especially the care homes. So we have opened that up. And the second question you had was dealing with CVS. I'm working with the CVS person right now, government affairs person. We're looking forward to trying to get testing for Hawaii, especially because our minorities and lower income bracket people seem to have a higher rate of COVID-19. So these are pretty easy self-administered swab tests that would be offered not inside CVS, but probably outside in the parking lot area or on the side of the stores. So we're trying to bring that to Hawaii.
Thank you so much. We ran out of time, but important to get those points across. Thank you so much, Representative John Mizuno, for joining us, telling us about these testing events. Good morning, Hawaii. We'll be back. Stay with us.